I am Yetunde Ayo Oyalowo, and my name tells the story of market doctors. In Yoruba culture, the name Yetunde is given to a first girl born after our grandmother died. In months before I was born, my grandmother had a straightforward case of diarrhea, easily treated if she lived near anyone who could treat her. But in days it took her to get to the hospital, it was too late. This tragedy shaped my life in many ways. My father, of blessed memory, encouraged me to go to medical school, in part to make sure that nothing like that ever happened to our family again. So I carried not just my grandmother's name, but a story, and that of millions of Nigerians like her who died because they could not get a doctor in time. Becoming a doctor confirmed what I knew from birth, that access to healthcare is far from equal. Many Nigerians live so far away from health centers that they would have to forego days of wages just to afford the transportation costs alone. When I became a doctor, fewer than 5% of Nigerians had health insurance. And today, more than 70% of the population works in the informal sector, where health insurance is even out of reach. Often, people are turned away at hospital doors or leave the hospital before they recover because they can't pay. It's a painful fact. Money keeps people alive. I knew if I wanted to prevent deaths like my grandmother's, I needed to meet people where they are. So I focused on a place familiar to almost everyone, the market. Electricity isn't always reliable in Nigeria, so we shop for perishables about 3 times a week. Nigerians get everything at the market: food, clothing, furniture, and we also find connection and friends there. So I thought, why couldn't people add healthcare to their shopping bags? I knew from my training that preventive care like blood pressure readings and diabetic screenings will make a huge difference for most people. It could even save lives. So underneath a canopy, sitting on a folding chair, my team and I welcomed our first patients. We called ourselves market doctors. So shoppers walking by with trays full of fresh tomatoes, grains on their hips, were curious to see us in our white coats, holding simple medical devices like stethoscopes, blood pressure meters, which they had never seen. Their first questions were expected ones. Are you a doctor or a nurse? How much will this cost? I will tell them that I was a doctor, and I was proud to say that healthcare was accessible and affordable right in the market. From that first stall in the first market, we have exceeded our dreams for the program. We have served more than 500,000 people in 2,000 communities across 18 states in Nigeria. We have worked with 7 mobile clinics to reach people in more places, delivering healthcare on a retrofitted school bus. We also provided hundreds of antenatal care kits to help women and babies stay healthy after birth. Our Health Connector pilot program is training community members to conduct basic health services in a fraction of the time it will take them to learn those skills elsewhere. From a simple pair of eyeglasses to complex diagnosis that leads to critical treatment, Market Doctor has changed lives, and it has saved lives. So our experience has affirmed something most of us know intuitively. Better healthcare for women means better health for those they love. So many of the market doctors have a story of treating a woman one day and seeing her return with her husband and children the next. Some 70% of our visitors to our outreach events are women. Women are our most powerful ambassadors. Looking back, I am heartbroken that I never got to meet my grandmother. But I'm also encouraged that because I know there are grandmothers holding their granddaughters right now because of the care they received at Market Doctors. That's why I'm going to keep growing Market Doctors as much as I can. I hope you will help women rewrite a new chapter in their family stories too. Thank you.